Thank you, Madam Chairman, for the opportunity to speak here today. Good morning, ladies and gentlemen. My name is Debbie Hocking, and I'm here to explain and summarise why people who are smokers should not be employed. Thank you to our formal speakers. It is tiresome and unbelievable that we're still hiring smokers in this age and day. As you heard from Kelly, smoking causes many different cancers and diseases that are serious health threats. Preventing smokers from being employed will initiate better healthy lifestyle, reiterating Alexander's argument that smokers cost the business downtime by the act of smoking and for illnesses. This is also a burden on our health system, with the highest health cost in 2004-05 by 11% of the total health expenditure of over $5.9 billion. If there are smokers within an organisation, this encourages non-smokers and reforms smokers to smoke. The argument that not employing smokers is unethical seems unintelligent when the alternative is a better quality of life and saving from an early death. Governments across the world have banned smoking in public places, restaurants, schools, shopping centres and workplaces. This result has reduced cigarette consumption in Australia and the United States. In 1988, the Massachusetts Police and Firefighters Department can legally not appoint smokers. Saying we are discriminating and overstepping the boundary by not employing smokers have already been addressed with weight-related issues. Many companies provide health insurance, corporate gym membership and healthy options in cafeterias. Corporations are already taking moral steps by sponsoring healthy benefits to their employees. Public image does impact an organisation. Teachers are role models who potentially influence adolescent students by being a smoker. It is not enough for a school to ban smoking on the premises, as this ban does not carry out outside school boundaries. Preventing this exposure to adolescent students would be simply to employ a non-smoking teacher to eliminate the risk. The concern that low socio-economic status are more likely to be smokers and deemed unemployable would be addressed by simply not employing smokers. A study in the Netherlands discovered lower socio-economic status smokers that identified themselves as non-smokers had a stronger intention to quit than higher socio-economic status smokers. The research measured that anti-smoking programs would be more effective if we can change the way smokers identify themselves to be a non-smoker. By employing non-smokers, this would change the view of oneself and then cease smoking. We should be encouraging low socioeconomic status to quit smoking. As you can see from the study, they want to, but need the right incentive, which is a job. In the 1970s and 1980s, Poland were one of the highest consumers of tobacco. The Polish government introduced smoking ban in public places, ban on tobacco advertising and health warnings on cigarette packets. They also increased the price of tobacco. All these incentives encourage people to quit smoking with little to no drug assistance or professional help. They found that smokers tend to quit by motivations such as their environmental influence, like smoking ban in public places. The research validated that tobacco control plays a great motivation incentive to quit smoking. Employing non-smokers is a great motivator for smokers to quit on their own will. Industries such as the armed forces have a strict fitness policy. If not maintained, this could cause injury to themselves or possible death to a colleague or civilian. Smokers do not exercise as much as non-smokers. They tend to eat high-fat meat more and less lean meat, vegetables and fruit. They tend to drink alcohol more than non-smokers. Financially, smokers are worse off. Not only the cost of cigarettes, but other costs associated with being a smoker. First, the outstanding price of cigarettes, health premium is more, medication and travel costs due to illnesses associated with smoking, and the extra cost of cleaning smoke, stain and smell. A report Levine has also indicated that employers will offset wages to employ smokers as they are a higher cost on insurance and production time. Organisations that do not employ smokers offer better paying jobs and benefits to non-smokers. Why should non-smokers be discriminated against for higher pay because their company is paying higher health insurance to compensate smokers? Society should not be enabling smokers by giving them an income. As you have heard here today, smoking causes health issues. Smokers are a cost to the organisation and to the health system. The argument that is discriminating not to employ smokers seems absurd when it should be a moral duty of corporations not to employ smokers. Smoking is a health risk and a fatal lifestyle that is preventable. Many organisations have addressed health issues by providing better health choices at their facilities to prevent weight issues. This is the ultimate step to bettering human life. As you've heard from my argument, this is the encouragement that low socio-economic status workers need. Motivation to quit. Smoking ban has been forced in public places around the world. Police forces in America legally do not employ smokers. The Polish government have put major steps to cease smoking and good results in smokers quitting. Organisations around the world do not wish to employ smokers because of public imaging and the influence that smokers as role models. Not only in the armed forces, the general smoker has lower fitness level and the attitude to better health is regressive. The ultimate cost of smokers is their hip pocket, in their wage, their outlay, and sadly their health. Corporations should be butting in on stamping out smokers in the workforce. Thank you.